So we're not to team time questions yet. I'm going to introduce our next speaker, and it's Dr. Melanie Duckworth. Dr. Melanie Duckworth is the Acting Branch Chief, Division of Community Health, Program Development Implementation Branch within the National Center for Chronic Disease Prevention and Health Promotion at the Centers for Disease Control. Dr. Jack, can we do anything about that title? Just playing. Her CDC experiences include serving as the Associate Director for Senior Liaison Services within the Office of State, Tribal, Local, Territorial Support, customized support for the Health Officials Unit, Public Health Liaison Officer assigned to the Office of Non-Communicable Diseases. Dr. Duckworth began her public health career as a presidential management intern, which provided her the opportunity to work within several different areas throughout CDC and several other federal agencies, including the National Institutes of Health, Indian Health Services, Department of Justice, Centers for Medicare and Medicaid Services, and the Substance Abuse and Mental Health Services Administration. So she's got a very well-rounded background of experience in education. Please give her a hand as she comes to the podium, Dr. Melanie Duckworth.
Thanks, everyone. And I, too, am from New Orleans, and so it's always nice to be back home. I'm often told that I don't sound like I'm from New Orleans, but give me a couple of days and I'll start saying my yeah, my no, and mom and em, and how things are going. So it all comes back after I'm here. But do you want me to do that?
Oh, no.
Okay, thanks. Okay, I'd like to start by thanking the organizers for the opportunity to share our vision. I also want to thank you for taking the time out from your busy schedules to be here. I joined the division in early January, and it's been a great opportunity to learn about the wonderful work that you're doing. I want to share a little bit about the chronic disease burden we are currently facing in the U.S. This information will help you understand why our division was created and why the work that you're doing is so important. Smoking in the U.S. About 1 in 5 adults smoke. 4 out of 10 non-smokers, about 88 million people, are exposed to secondhand smoke. More than 1 out of 2 kids aged 3 to 11 are exposed to secondhand smoke. Obesity in the U.S. This is one of our greatest challenges facing our healthcare system. Obesity is common, serious, and costly. More than 72 million U.S. adults are obese. That number continues to increase. People who are obese have medical costs that are much more higher than those with normal weight. This epidemic has affected every part of the United States. In every state, more than 15% of adults are obese, and in 9 states, over 30% of adults are obese. Children and obesity. About 1 in 5 preschoolers are obese. However, obesity among low-income preschoolers declined from 2008 to 2011 in 19 of 43 states and territories studied. Children who are overweight or obese as preschoolers are 5 times as likely to become obese adults and suffer physical and mental problems. Tracking trends in obesity by race and/or ethnicity among young and low-income children can help identify health disparities and prioritize obesity prevalence control programs. In terms of physical activity, more than 145 million adults now include walking as part of their physical active lifestyle. Walking is the most popular physical activity, and about 5 in 10 adults reported walking for at least 10 minutes in the previous week. Adults who walk for transportation, fun, and exercise was up by 6% in 5 years. Now I'd like to share some information about our division, the Division of Community Health. Here's our organization chart. We have 3 branches, the Program Development and Implementation Branch, the Research, Surveillance, and Evaluation Branch, and the Training and Translation and Communication Branch. There are 3 offices: the Office of Policy and Partnership, the Office of Health Equity, and the Management and Operations Office. Advisory roles includes the Associate Director for Science and the Chief Medical Officer. Note that the Development and Implementation Branch is where the current cooperative agreements are managed, and where the project officers are assigned to the awardees in helping the awardees in meeting the overall 3-year funding period activities. Our mission is to promote sustainable community action and improve health and achieve health equity. Our charge is to make healthy living easier for our people where they live, learn, work, and play. Our commitment is guided by 3 core principles: maximize public health impact, advance health equity and reduce health disparities, use and expand the evidence base. Sharing evidence is a critical part of this core principle. It enables communities to learn from each other. By using evidence-based strategies, communities are much more likely to meet their health improvement goals and spend resources more efficiently. Here's the factors that affect health, and the smallest impact being counseling and education, to the largest impact, socioeconomic factors. Our division works around changing the content to make individuals' default decisions healthy. This is an article that was written by Dr. Tom Frieden entitled "The Framework for Public Health Action, the Public Health Pyramid." Community health programs. This slide outlines previous community health programs. First is the Community Transformation Grants, known as CTG. REACH, the Racial and Ethnic Approaches to Community Health. Communities Putting Prevention to Work, called CPPW. And Health Communities, in which there are several activities that fall under that criteria. CTG addressed weight, nutrition, physical activity, tobacco use, emotional well-being, and overall mental health for millions of Americans. REACH focuses on reducing disparities in racial and ethnic populations. CPPW focus was to drive local initiatives that made healthy living easier for more than 50 million people through sustainable strategies and environmental improvements. Healthy Communities included several programs: Pioneering Healthier Communities, ACHIEVE, which stood for Active Communities for Health Innovation and Environmental Change, Steps to a Healthier U.S., and the Strategic Alliance for Health. CDC's history of community health investments. I won't read all this in detail, but here's a look at CDC's community health programs, their duration, and the number of awardees working to make healthy living easier. Since 1999, we have funded more than 600 programs and supported hundreds of communities across the country. Here are our currently funded programs: PITCH, the Partnership to Improve Community Health, in which there are 39 awardees; the National Implementation and Dissemination for Chronic Disease Prevention, simply known as the National ORGs, in which there are 5 awardees and several sub-awardees; and REACH, the National and Ethnic Approaches to Community Health, in which there are 49 awardees. Go back. PITCH provided funding to work through multi-sectorial community coalitions that represent 3 designated geographic areas: large cities and urban communities with populations of 500,000 or more, small cities and counties with populations between 50,000 or less than 500,000, and American Indian tribes and Alaska Native villages and tribal organizations. Then the national orgs support two categories of funding: community capacity building and implementation, and the dissemination and training. REACH, which is the 15-year-old program, supports implementing locally tailored evidence and practice-based population-wide improvements in priority areas. An example of the PITCH program is the Boston Public Health Commission. Boston Public Health Commission is collaborating with the Boston Alliance for Community Health, the Harvard School of Public Health Prevention, research centers, and a large range of community partners to improve nutrition, increase physical activity levels, and protect residents from secondhand smoke exposure. An example of one of the programs funded under REACH is from the University of Alabama at Birmingham, who is working to enhance the built environment. The REACH funding is allowing UAB to engage its coalition of more than 100 members to increase nutrition and physical activity opportunities for African Americans throughout the Birmingham area. Currently funded programs, PITCH, the national orgs, and REACH, seek to achieve the following goals: to reduce rates of death and disability due to tobacco by 5%, reduce prevalence of obesity by 3%, reduce rates of death and disability due to diabetes, heart disease, and stroke by 3%. Earlier, I mentioned that advancing health equity was one of our core principles. How do we advance health equity? Advancing health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequities, historical and contemporary injustices, and the elimination of health and healthcare disparities. Awardees are encouraged to use the twin approach, which is the implementation of strategies for the general population coupled with tailored interventions to vulnerable populations. For example, a community has a considerable number of affordable and public multi-unit housing. A community-wide strategy is implemented to protect residents from secondhand smoke in the living areas of public and private multi-using housing. For the general population, private multi-use property agents and managers agree to implement a smoke-free strategy in the living areas of local apartments and condominiums. Smoking cessation fee-for-services classes are offered by local agencies, or programs are advertised for property employees and residents there. Simultaneously, the same smoke-free strategy is implemented among vulnerable populations by the Public Housing Authority. In addition, managers of the Public Housing Authority engage residents in the implementation of the strategy. Because residents of the public housing units are of low income, low socioeconomic status, those needing assistance are referred for low-cost or no-cost smoking cessation services, and treatment is offered on the property by local agencies and providers. The future focus of the Division of Community Health is to promote sustainability for programs to continue work post-award, build the evidence base of best practices and approaches that maximize impact, communicate the successes of community-based health approaches, and share the evidence base with non-funded communities. Now come to the end of my presentation.